Then we've got the new science here, the endocannabinoid system. Again, we've said over and over how it's not in the medical schools yet or the nursing schools yet. And then think of all of the practicing clinicians out there. I mean, I really think it's up to like high 90s. I used to say 99%, and I don't know, maybe it is that high, but the high 90% of our healthcare professionals don't know about the endocannabinoid system. I mean, the biggest discovery that we've had for a century at least, and it's just not, it's not on every news show, it's not out there, it's just amazing. But the fact that we make these chemicals just like in the plant, and we now think that some of our age-related illnesses might be due to a deficiency in this, it literally is a crime for healthcare professionals not to know about the endocannabinoid system. Yeah.
Patients Out of Time's mission is to educate healthcare professionals and the public about the endocannabinoid system and the therapeutic use of cannabis. We believe education based on science can help end the wrongful prohibition of this plant. As the longest operating educational charity dedicated to cannabis therapeutics, over the last 20 years, Patients Out of Time's conferences have brought together the world's leading scientists and clinicians in these accredited educational forums.
Maybe not us, but in the medical community. I didn't hear anything about cannabis patients in nursing school until maybe somebody brought it up.
Patients and caregivers have shared their experiences and remind us all of the incredible potential of cannabis to alleviate suffering.
Reduced anandamide levels in the cerebrospinal fluid of chronic migraine patients support the hypothesis of the failure of this endogenous cannabinoid system in chronic migraine, which seems to be related, again, to calcitonin gene-related peptide, nitric oxide. This finding might be due to a failure of the inhibitory role of the endocannabinoid anandamide on the trigeminal-vascular system activation. In other words, migraine is an endocannabinoid deficiency disorder.
Beyond leading-edge science and research, conference attendees benefit from the networking and socializing opportunities. Celebrating their successes, being inspired and rejuvenated to continue the effort of spreading the truth about cannabis.
Setting ourselves up for bullseyes on our back. And a lot of these people took a hell of a beating for putting that bullseye on their back. I can't tell you how many lives that worked with us and were destroyed because they worked with us. I can tell you stories of 4 or 5 interventions when we tried to have conferences like this where the White House drug czar called up people and said, don't you dare. Don't you dare let those people on your campus. Don't you dare let those people teach anybody about the medical cannabis. And I have to say, you know, those people that were threatened along with us stood there with us. But I want you to understand that it's not about Marilyn and I. We are figureheads. We decided that there were people out there like you that could do this with us. And we were right. So that's your job here. You came. You paid your money, we're going to educate you, now go do something with it, okay? And that would be the best reward you could give me.